For this lesson, we'll need to know some anatomical terms for the hand and wrist. Metacarpals, the bones of the palm. Metacarpophalangeal, or MCP joints, the joints between the metacarpals and proximal phalanges. Carpals, the bones of the wrist. And carpometacarpal, or CMC joints, the joints between the metacarpals and carpals. Radial carpal joint, the joint between the scaphoid and radius. Now let's apply these terms and use them to identify the corresponding anatomy. There are 13 bones in the hand and wrist, 5 metacarpals and 8 carpals. You may recall from the lesson on the digits of the hand that there are also 14 phalanges. If you need a way to remember these bone classifications, just remember, people make choices from distal to proximal. Phalanges, metacarpals, carpals. The palm contains 5 metacarpal bones, numbered 1 through 5, like the digits, starting from the thumb or lateral side when the hand is in anatomic position. These bones connect the wrist to the phalanges and consist of 3 parts similar to the digits. Distally, there is a rounded head which articulates with the phalanges. Next, the body or shaft is the long curved portion with a concave anterior surface and a convex posterior surface. Finally, the proximal portion or base articulates with the carpals. The carpals are divided into a proximal row and distal row. On the proximal row, beginning with the lateral or thumb side, is the scaphoid, lunate, triquetrum, and pisiform. The distal row, starting again on the lateral side, consists of the trapezium, trapezoid, capitate, and hamate. The first metacarpal articulates with the trapezium. The second metacarpal articulates with the trapezoid. The third metacarpal articulates with the capitate. And the fourth and fifth metacarpals articulate with the hamate. There are some mnemonics that can help you to remember the order of the carpal bones. One that names the carpals in a circle, starting with the proximal row on the lateral side, is so long to pinky, here comes the thumb. Scaphoid, lunate, triquetrum, pisiform, hamate, capitate, trapezoid, trapezium. Other mnemonics describe the position of the carpal bones from the radial to the ulnar side for both rows, proximal, then distal. Sally left the party to take Kathy home. Scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, hamate. 2 of the carpal bones, the trapezoid and trapezium, have similar sounding names. A way to remember the difference between these bones is the trapezium is under the thumb, and the trapezoid is inside, surrounded by 4 other bones. Carpal bones are also named for their shape, which can help with identification. Scaphoid, boat-shaped on PA, or postero-anterior projection. Lunate, crescent-shaped on lateral. Triquetrum, triangular. Pisiform, P-shaped. Hamate, with a hook. Capitate, head-shaped, large and central. Trapezoid and trapezium, table-shaped or 4-sided. The joints or articulations between the individual bones of the hand and wrist are also important to know because small chip fractures may occur near the joint spaces. You may recall from the joints of the body lesson, these joints include the metacarpophalangeal, MCP joints, which are classified as ellipsoidal or condyloid joints. Carpometacarpal, CMC joints, which are classified as saddle, first digit, and gliding, second through fifth digits. The intercarpal joints, which are also classified as gliding joints, and the radiocarpal joint, which is classified as an ellipsoidal joint. The routine radiographic projections for the hand and wrist include PA, PA oblique, and lateral. As discussed in the radiographic projections lesson, PA or postero-anterior means the beam enters the posterior portion and exits the anterior portion. For the hand and wrist, this means the hand is pronated, so the palmar surface is against the IR. The hand and wrist are imaged using the PA projection primarily to minimize OID, but also because this is a more natural and comfortable position for most patients. The PA oblique projections of the hand and wrist are performed with the hand pronated and the wrist and hand rotated 45 degrees laterally or externally away from the median plane of the body. The lateral projection of the hand and wrist are routinely performed in a lateral medial position, with the beam entering the lateral portion and exiting the medial portion. The hand can be performed in a fan lateral position or an extension lateral position, which refers to the position of the fingers. Typically, the fan lateral is preferred over the extension lateral because the fan lateral projection removes superimposition of the digits. So in summary, the hand and wrist are made up of 13 bones, 5 metacarpals in the palm of the hand and 8 carpal bones in the wrist. The metacarpals articulate with the phalanges at the metacarpal phalangeal (MCP) joints and the carpal bones at the carpo-metacarpal (CMC) joints. The carpal bones also articulate with the radius at the radiocarpal joint. Routine radiographic projections of the hand and wrist include the PA, PA oblique, and lateral.